Hello, my name's John Ebbett and I'm President of the Ankylosing Spondilitis Group in Queensland, Australia. Welcome to this DVD of specifically designed stretches and exercises for people living with ankylosing spondylitis or AS. All participants in this DVD are people living with AS. The exercises and stretches shown in this DVD have been specifically designed for the treatment of people living with AS and will be described and explained by Margaret Lewington. Margaret is a consultant physiotherapist to our group, and Margaret also has expert knowledge of and practical experience in the physical therapies for people living with and managing their AS. I hope you enjoy these exercises.
I'm Julian DeYaga, a consultant rheumatologist from Southport, and I've had a keen interest in ankylosing spondylitis for many years. Ankylosing spondylitis is an inflammatory arthritis that affects the spine and sacroiliac joints and may eventually result in fusion. One of the crucial pillars of management is exercise, along with anti-inflammatory drugs and now anti-TNF medication. Exercise has the ability to increase strength, maintain mobility, reduce the risk of osteoporosis and reduce pain. I strongly recommend this DVD to you as a means of achieving these aims.
Welcome to this DVD of exercises for people with ankylosing spondylitis. Regular, specific exercise is essential for managing your AS. As appropriate exercise is crucial to managing your AS, this DVD is designed to show you ways of exercising that are the most beneficial for you. It is designed to give you some ideas about how to exercise. It may get you started. It may help you adapt an exercise program you are doing to get more out of it. Regular, specific exercise is important at all stages of your AS and for all people with AS. If you are fairly flexible, it is important to work hard to keep this way. If you are more stiff, it is often hard to do some of the exercises, but you will improve if you do. If you do not keep exercising, you will get stiffer and have poor posture. If you are taking the newer anti-TNF biological medications, it is essential to continue to exercise, as you will lose improvement if you don't. Some of you will not be able to do the exercise to the extent as is demonstrated, but it is important to do as well as you can. If you are not used to regular exercise, you may need to have a general health check with your GP first. Start the exercises gently and then progress. Relax and breathe freely throughout. Don't hold your breath. If you should experience any unusual symptoms, such as sudden pain, shortness of breath, dizziness, pins and needles, stop exercising and seek help from a health professional. These exercises are designed especially for people with AS. It is not unusual to feel some discomfort. This should not stop you doing them. Most of the pain and stiffness is from the inflammation in your body. You are not doing harm. With time, the exercise will help ease the pain and stiffness. It may take time to feel better. At first, you may feel a little soreness from doing new and different activities. Persevere and stick with it, and you will feel the benefits. As stiffness and loss of flexibility are the greatest problems for people with AS, the most important exercises are those that encourage movement. Exercises that help you to loosen up and feel freer are the best for you. Start the movement small and gently, and then gradually increase. You can go a little bit further and get a little bit of a stretch. Be aware of which part of your body is moving. If you find your shoulders are moving too much, pop your arms out to the side, and this will stabilise that area and allow you to get more movement through the lower part. You may also turn your head to the opposite way that your knees go, and this adds further stretch. Notice that as you come across, you can get movement through the whole back area. Now rolling onto your side, and if we do a mobilising exercise for the upper part of the body. In this position, the knees can be comfortably bent and the arm is going to stretch forwards as far as you can, then lift up, look at your hand as it comes back behind. reaching forwards, stretching as far as you can, feeling a stretch across the back area. Lift the arm up, following your hand with your eyes and taking it back, feeling a stretch across the front of the chest. And again, reaching forwards. Make the movement slow and relaxed. Move with ease and comfort. Keeping the body soft allows it to change and adapt. It takes time to feel improvement. Eventually, you may wish to work with a little bit more vigour. Regular stretching improves the flexibility of muscles, tendons and other soft tissues, which, as a result of inflammation, have become sore and difficult to move. If they are not stretched, they become shorter and tighter. This can make it hard to stand up straight, to turn and bend, or to take a deep breath. As we saw in the mobilising exercises, we can move to the end of our movement, rest and get some stretch. This will help maintain and maybe get some increase in movement. However, to try and improve and stretch even more, it is important to use other techniques. Sometimes when we are targeting a particular muscle, for example a hamstring at the back of the thigh, we will use a technique called proprioceptive neuromuscular facilitation, or PNF. With this, we are going to move forwards till we feel a little bit of a stretch on the muscle. Then we want to make the muscle work, so we will push the heel into the floor, then relax, and then lean and stretch a bit more. In this new position, again, we'll make the muscle work by pushing the foot into the floor, relax for a couple of seconds, and then leaning forwards, stretching, making the hamstring muscle longer. One more time, push the heel into the floor, relax and stretch. Getting a little further each time. Then relax and sitting back up. As well as stretching specific muscles, sometimes we want to stretch in the direction of a movement, and this stretches several muscles and other tissues. For example, if we were trying to do trunk rotation and stretch these structures, firstly we would go around to the left as far as possible. We would then hold that position, but pushing back into our hand, working the muscle for about 3 seconds, relax for 1, and then turn, taking it further around into the movement. Holding that position, again pushing back, about 20% effort, don't make it too hard. Relax and stretch again, turning and looking around. One more time, pushing back, relax, and then stretch a little bit more. 3 repetitions is very useful. To come back to the front, give yourself a little bit of resistance and push into your hand to return to the front. Strong muscles support the body. The muscles that are important to strengthen are the postural and anti-gravity muscles, mainly on the back of the body. If we lift up against gravity, we're developing strength and particularly endurance of these muscles, and that is going to help us with keeping our body upright and our posture good. And down. Lift again, holding, keeping it steady, don't hold your breath, and then relax and go down. Most exercises do more than one thing. Changing how you do it can change it from a mobilising exercise, a stretching one, or even strengthening, such as bridging when you lift the buttocks off the floor. We can go up and down nice and steadily, making it more of a mobilising exercise. We can add a little bit of stretch by ensuring we come all the way up, getting some stretch and holding on the front of the hips. We can also get strengthening out of this exercise as the legs are supporting the body, the thighs and the buttocks are working to keep the body straight. And down, and relax. A physiotherapist is the best person to help you with your own specific program to address your individual needs. They can develop a personalised program and can adapt and progress your exercises to help you get the most out of your exercising time. They can also help with pain relief, advice on posture and activities, and provide treatment as indicated. Other exercise professionals may be able to help you with your exercise technique and motivation to continue. We will now do a number of sequences of exercises in different positions. We will only do a few repetitions of each. However, when you're doing them yourself, do a few more. We'll do them mainly with the emphasis on moving and mobilising. When you're doing them yourself, you can rest and stretch and go a little bit further. We'll start up with a warm-up. We want to get the muscles warmed and exercising before we stretch further. Walking on the spot. Lifting your chest tall. Swing those arms. And lift the knees a little bit higher. Hand across to the opposite knee. And now the elbow turning at the waist. Twist and twist around as far as you can. And then heels up behind. Kicking your heels towards your buttocks. And now heel tap in front. Again. And going behind. Stretch. And stretch. Let the legs relax. And let's swing the upper body. Turning. Relaxing. Lean forwards at the waist and swing side to side, looking as you go. Up tall and a big stretch and down. One more. And this time up we go. Look, reach and stretch. Relax over. Hang. Stretching out, then bend your knees, coming up, and relax. And now we'll get down on the floor. Now lying on your backs, and we'll do a few exercises. Bend your knees up, have your feet flat on the floor and comfortable. Support your head as you need. Some will need a pillow, some may just need a small folded towel to support their head and make sure it's comfortable and relaxed. First of all, we'll do some knee rocking from side to side. Position your arms where they're comfortable, but also more out to the side will help keep your shoulders on the floor. Nice big stretch from side to side. Coming back into the middle, and we're going to do bridging, lifting your bottom. Lift and down. And again, lift. Holding and down. Now bringing your knee to your chest. Bring one knee up, hugging it to your chest as much as you can manage. Gently back to the floor, and then the other one. Having your hands behind the thigh, avoid strain on the knee joint and down. This time being both together. Curling and stretching the low back as you do that. A nice stretch for the back and feet on the floor. Let the knees drop apart, out wide and up tall. And again, out, hang, stretch and up tall. Put your legs out long and slide the heels apart. Push them wide and bring them in. And one more, out wide, stretch and slide them back. Very good. And relax. Bending your knees back up. If that's the comfortable position, you can leave them down if you wish, and we'll do some exercises for the arms and upper body. First of all, arms by your side, lifting them up and over your head to the floor above your head, and back down. And again, taking them as far as you can. If you can't get there, just best effort. And down. One more up, over the head, and this time stretch one arm longer than the other, getting a stretch down the side of the body as you reach long. Coming back up so they're over your face, pointing to the ceiling, and drop the arms out to the side and bring them up to the top. And out wide, keep the palms to the top and up, pointing to the ceiling and stretch. Again, going quite tall, reach, feel the shoulder blade come off the floor, lengthening the body. And now bring them back down by your sides and a big sweep all the way along the floor to above your head and back down. Try and keep your fingertips touching the floor, but many of you will have a bit of trouble, and that's fine. Stretching and back down. Finish off putting your hands behind your head and bring your elbows in front of your face and then drop them out to the sides. Feel a stretch across the front of the chest. Bring them up and out for a stretch. And relaxing there, taking a deep breath, expand the lungs and rest. And now rolling on your side. We'll do a few exercises in side lying. Make sure you're right on your side, the hip stays forwards and your knees can be comfortably bent. Support your head if you're not using a towel or a pillow, just by bending your elbow and putting your hand underneath. The top leg, we're going to cycle. Bend the knee up towards your chest, down, stretch long and a little bit behind. Coming up, round in a big circle and stretch the front of the hip as you go back a little bit. One more time, up, down and around. Bring the knees back together, keep the feet together and lift your knee and back down. Very important to keep the hip forwards and again, lift the knee. You may like to put your arm in front to keep your body forwards and down. And one more time, up and down. This time lengthen and straighten that top leg, resting it down a little bit. Hip hitching, shift your hip up towards your shoulder, then lengthen and stretch your leg. Hitching towards your shoulder and stretching down. One more, up and down. Bring the knees back together and rest them together with your arm. Bring it down by your side and lifting up and over to touch the floor if you can. And back to your side. Make sure you stay on your side as you do that, and it's a side arm lift. And back down. One more. Breathe in, expand that rib cage, and back you come. Forwards and back. Put the arm in front and reach as far as you can. Allow that top part of your body to roll forwards, lifting up and stretch and roll back. And again, follow your hand with your eyes, look, lean and stretch, up and back. If you find your knees lifting too much, bring this hand down, holding them steady, and you can get a little extra stretch as you go. Forwards and rolling, up and back, and get a long stretch across your body. And back on your sides and relaxing. Now doing some exercises in kneeling. First of all, kneeling upright, lifting your chest, relaxing your shoulders, bringing your hips gently forwards, keeping tall. Taking the arms out to the side and up and over your head. Looking at your hands and gently down. And one more. Big breath in, stretching, reaching to the ceiling, and back down. And now leaning back a little. Lean back, feel a stretch on the front of your hip, and up. And again, lean back, balance, stretch, and forwards. Come down onto your hands and knees. Have your hands comfortably underneath your shoulders. knees apart a little underneath your hips. And first of all, we're going to do a cat stretch, arching up to the ceiling. It's easy to feel a stretch between the shoulder blades, a little bit harder in the low back, and then dropping towards the floor. And again, lifting up, stretch and arch between the shoulder blades and the low back, and then dropping and hollowing, and the chest is dropping towards the floor. One more, up, allow the head to relax and go with the movement, and gently down and looking forwards rather than up. Now we'll get you to bring one knee forwards towards your chest and looking down as you do that, getting a good rounding and stretching. Then take it out behind, working the muscles. And again, in, curl and stretch, and out behind. And change legs. Coming in, let that head go forwards, and stretch out, holding behind and comfortably up with the neck. And again, in and out. And back to rest. This time, balancing and strengthening. Take one arm out in front and then the opposite leg, holding, straightening as much as you can. And gently down. And the other one. Opposite arm and leg, holding, stretching, reaching. And back down. Very good. And now take one arm and bring it underneath your tummy and around towards the opposite shoulder blade. And back down and out. Very good. Down and through. Feel your upper body rolling and rotating. And back you come, looking at the hand the whole way. And rest. Do the other side. Come through and back out and up. And again, gently through and up. Both hands flat on the floor and looking towards one ankle. Looking around this side towards your ankle and then the other side. As you come to one side, we're wanting a stretch on that side of your body, and then go the other way and feel some stretch. Trying to keep your hips fairly steady and make the movement come through here. One more each side, looking around, stretching and looking, and to the other side. Very good. And now sitting back on your heels. Leave your arms forward, bottom comes back as flat as you can to the floor, dropping your chest and the shoulders are in front. Then coming back up into 4 points and drop back again, feeling a stretch through the buttock. This low back area is stretching out and dropping the chest and resting. Coming up, this time we'll do it a little bit to one side. Both hands go to one side and dropping back and across, feeling more stretch through the side. Coming up, bring the arms to the other side and drop back, stretching along the side as well as the low back. And back to 4-point kneeling. And relaxing. We'll now do some exercises lying on your tummy. For some people, this is a reasonably comfortable position and you can lie fairly flat. Other people have a lot more stiffness and it's quite difficult to get the chest and the shoulders down or the front of the hips. Sometimes a pillow is helpful to support, but only if you're really needing it. But it does enable you to do a few more exercises. Don't worry if you can't do these exercises with large movements. The best you can manage is important. First of all, bring your elbows in underneath your shoulders and getting a curve in the low back. Relax down again. And then again, coming up, bring the elbows under your shoulders, feeling a stretch on the front of the hips. The back is arched, the chest is dropped forwards, and just looking to the front. And relax down. Bring your hands back underneath your shoulders this time and push to straighten your arms as much as possible, but only as far as you can while your hips are still close to the floor. Relaxing down and coming up again. The hips are on the floor. Feel a stretch through the tummy muscles. The chest is forwards and looking to the front, not up too high. And gently down. Let the upper body relax for a moment and bringing one heel towards your buttock. Let it bend back and the other one comes. And down. Bringing the heel up, trying to keep the hips still, getting a little stretch on the front of the hips and the front of the thigh. And down. And one more. Up. And down. And relax the legs. Stretch your arms as far as you can in front of you and keeping your legs long. This time lifting one leg and the opposite arm, just a small amount, and relax and down. And again, lift. If you can't lift the hand off the floor, that's fine to still just get the muscles to work as if you were. Lift and down and attempting to lift and gently down and relax. And now taking your arms down by your sides, long beside your body, and the palms preferably facing the floor. We'll do some exercises for this upper body. First of all, just lifting the shoulders off the floor and then relax them. And again, use these muscles to bring the shoulder blades together and a little stretch on the front of the shoulder and gently down. This time, let the shoulders come up as well as the hands off the floor. Just a small amount. And back down. And again, shoulders and hands and down. A little bit more this time. We're going to lift the shoulders, hands and the upper body. Looking forwards if you can, but not up. And down. And one more. Lift, hold, and down. Bring your arms around so their palms are in front and your elbows are bent. This time lifting the shoulders and arms only, and lift, and hands, and down, both hands, and lift, and down. And this time the upper body as well. Lifting arms, hands and head and gently down. Trying not to hold your breath. And one more. Lift, hold, working the back muscles and down. Relax. To finish off, a combination of a few of these exercises. Come back onto your hands and knees in 4-point kneeling. And we're going to sit back on our heels first of all, bringing our chest to the floor, and now travel forwards, taking your nose as close as possible to the floor, going forwards, drop your hips and coming up into an arched position, and then come up, sit back on your heels and repeat. Nose forwards, flattening and arching through the back, up into an arch and back onto your hands and knees and relaxing. We'll now do some exercises sitting in a chair. Most of us spend quite a bit of time sitting in a chair, whether it be at your office desk, sitting at home at the table, or sitting in the car and driving. It's important to have good posture in sitting. We want to sit tall, shoulders are back but relaxed, chest up and chin relaxed. There should be a gentle curve in your back. You can slump and relax down and round and stretch your back, and then sit up and get a bigger curve. Down again, slump and relax and stretch, and coming up, opening the shoulders and arching. Then when you want to exercise, come just to a middle position with your back. Bring your elbows back against the chair And this time push back with your elbows and arch by bringing your body forwards. And rest back. And now push back with your elbows and forwards with your chest. And relax. Also in this position, put your hands on your lower rib cage and do some deep breathing. Breathe in, trying to expand down low in that chest, and relax and just give a little bit of pressure and pushing in. Breathe in, feeling the ribs move out, and relax and pushing in. And resting your arms down. This time let your head fall forwards towards your knees and feel a greater stretch through the back of the neck, the shoulder area and your low back. And then come up and nice and tall. And dropping forwards, looking down, stretching and coming up. Next, take your hands down between your feet, going further forwards as far as you can manage, dropping that head, stretching through your back, and coming up. One more down to your feet, stretching all the way as far as you can, rounding and stretching the low back, and up. And if you can go a little further, try and reach through underneath the chair, looking at your hands all the way, stretching, going as far back as possible, and then come up and forwards. For the next few exercises, some of you may find a bit more secure if you tuck your feet round behind the backs of the chair. Let the arms drop beside you, keeping tall throughout. First of all, leaning to the side, dropping down to one side and up and to the other. Taking the hand down the back leg of the chair if you're able to avoid leaning forwards. And again, this time as you go to the side, take the other arm up and over and stretching it as far as you can. And again, down to one side, up and over. Feeling the stretch down the side of the body and back to straight. Turning. First of all, taking your hands, both hands together around to one hip, keeping down low, but trying to feel the body turn. Come back to the front and around to the other side, rotating and turning the body and back to the front. This time, turn but touch the top of the chair and feel that movement in a different area in your back. And again, keep the body tall as you turn, reaching and looking to the other side at the top of the chair, and relax. You can get a lot of these movements similarly done with your hands on your shoulders. Placing the hands comfortably on your shoulders. If you can't touch your shoulder, have them nearby and just relaxed. First of all, bringing the elbows to the front and then taking them wide. Very good. Touching in front if you're able to. And as they come wide, not only the elbows moving back, but feel the stretch from the breastbone across the front of the chest. One more time. Forwards, rounding and stretching, and back and opening. Circling the elbows backwards now. The tips of the elbows going back, but always feeling a stretch on the front of the chest as you do that. And now side bending. Taking one elbow down towards your hip and the elbow up towards the ceiling. To the other side, one elbow to the hip and the other one to the ceiling. And again, over. As you're in this position, take the top arm and give that extra stretch right from the arm, shoulder and the hip. And to the other side, over. And a nice big stretch down the side of the body. Back onto the shoulders and again turning, looking to one side and looking to the other side. Follow that elbow so that you're looking right behind, and turn and turn. Let's finish off this one with taking your elbow to your opposite knee. Place your feet flat in front, will probably balance you better, and taking your elbow down and across, thinking of that stretch and the other elbow coming high. Come back up straight in the middle and then down and across, lifting the back elbow high. Come up tall, one more each side. Down and across, twisting and rotating, up tall, and again. And again. Relax, let your arms rest there. Deep breath in, expanding those lungs, and rest the shoulders and breathe out. Throughout the day, gravity is trying to pull us forwards and makes it a lot harder to stand up tall and straight. It is important to check your posture, and to do this, if you stand with your back against a wall, take your heels back, your buttocks back, shoulders, let your chin stay forwards a little bit, but trying to get your head as close as you can to the wall. It is important to check your posture regularly like this, even daily or at least once a week. Once you've achieved your best posture, try and stay in this position as you walk out away from the wall and move through your daily activities. Other positions can be resting on the floor. Flat on your back is a lovely way to stretch out and relax. You can take your arms up over your head and add a little extra stretch. If you're unable to get your head back onto the floor, use a couple of towels as a support. It's better than a pillow in most instances, as after you've been resting in this position for a while, you may be able to take a couple of layers out and stretch back a little bit more. Although Bill is unable at this stage to get his head back to the floor completely, he does find that if he stays in this position, relaxes, does some deep breathing for about 15 minutes, he's then able to manage without any towels at all. If you're able to manage on your tummy and don't find this too uncomfortable, it's also a very good position to ensure that the body stays straight. It's particularly good for getting a stretch on the front of the hips. Some people with tight hips find that fairly uncomfortable, and in that situation, lying supported on a bed, perhaps with the legs hanging over. The weight of the legs is pulling down and giving a little extra stretch to the front of those hips. Fatigue is a common symptom with AS, and poor posture develops when you're tired. It is important to manage the fatigue, rest often, and also manage stress. While you're relaxing in these stretched out positions, it's a good time to practice relaxation techniques and re-energise yourself. The neck is a very important part for people with ankylosing spondylitis. It often becomes stiff and sore and tight. It is important to keep it as flexible and moving as much as possible to avoid restrictions for driving and other functional activities. Thinking of your posture first of all, it is important to sit tall, have your shoulders relaxed, try and lift your chest a little and keep the chin dropped down and tucked in softly. In this position, we can do a nodding activity to stretch the top part of the neck, elongating and lengthening on the back upper part of the neck. Also, we can do other movements of the neck, such as turning from side to side. It is good to check the range of movement you have regularly. If you can get fully around, this exercise might be sufficient for maintaining your range of movement. You can look around and pause, turning, stretching, trying to go a little bit more, then relax and look to the other side. Look, turn, stretch and come back. However, if your movements are limited, you may need a little assistance to get that little bit extra. To do this, use the PNF technique we mentioned earlier. If we turn to the left, we'll put the left hand up onto that front cheek, supporting it comfortably. The right arm should stay still, particularly the shoulder. Placing the hand behind the back can assist in this. Firstly, John will turn to the left as far as possible. In that position, he will push back into his hand, not allowing any movement to occur, then relax, and then turning just a little bit further. Holding that new position, he will again push back, only about 20% effort, not too hard, for about 2 or 3 seconds, relax for 1 second, and then gently turning, looking and stretching a little bit further. Lastly, repeat it for a 3rd time, push to the front, relax, and then trying to go that little bit further. Relaxing the breathing, resting, stretching. To return to the starting position, push into your hand with a little bit of resistance to return to the front position, and then rest. This is important to be done in every direction that your neck moves. This includes a chin tuck and curling the top part of your head over and applying the stretch from behind. This stretches the top part of the neck. Coming back up, we can also stretch the lower part of the neck and even down the back by letting the whole head go forwards, dropping your chin towards your knees. This gets a greater stretch over the upper back. Coming up, it is also important to stretch looking up towards the ceiling. The hand can go on the chin, and this stretch not only works the neck, but you may feel it on the front of the chest. If you find you are tilting your head and scrunching the back part of your neck too much, you may wish to use your other hand to support the weight of the head and help it be a full movement stretch. And relaxing. As well as the rotation or turning we just showed, it is also important to side bend, taking the ear to one shoulder, and the hand comes over to assist. The other arm can stay long, stretching the fingertips to the floor or holding the edge of a chair. This then gets the stretch in the muscles and tissue structures on the side of the neck. Gently up. Lastly, if we do the diagonal muscle that comes down to the shoulder blade, if you look down and across towards your armpit, bring your arm up and over the back, again stabilising your shoulder slightly behind this time, and stretching forwards and across to feel the stretch in this area. And relax. All these stretches should be done to both sides and should be done with the contract-relax technique. Do them slowly, gently and carefully, no jerking, and relax your breathing throughout. People with stiff shoulders who find it hard to get their arms well above their head can take their arms up as far as possible, placing them on the wall, and then allow the body to drop forwards to get some stretch on the front of those shoulders. It can also be done side onto the wall for the side lift of the arm, placing the arm up tall and then leaning the body in towards the wall, getting a stretch up the side of the arm. And rest. The pectoral muscles on the front of the shoulder and chest are important to be stretched. You can do this by supporting the arm against a wall and then moving slightly forwards and turning away from that side. This stretches the full muscle from the sternum or breastbone across to the shoulder, but avoids stress and strain on the shoulder joint as some other positions cause. It also enables you to do one side at a time, which is important because rarely are both shoulders the same. And relax. The hamstring muscle at the back of the thigh is an important one to stretch. If you place your heel on a chair and then lean forward at the hips, sliding your hands down until you feel a stretch in that hamstring muscle is a common way of stretching. Alternatively, you can lie on the floor, bringing the knee up and then straightening your leg, pushing the heel away. A third way is to use a towel or a strap around your foot and lift the straight leg up, feeling the stretch in that hamstring muscle. The quadriceps muscle on the front of the thigh, which goes partly over the hip and partly over the knee, is also important to be stretched. Standing, bringing the heel towards your bottom and supporting it with your hand or a towel or strap if you need to. In this position, it is important to keep the knees close together, the knee directly under your hip and perhaps slightly backwards. Keep the body tall and don't overarch your low back. Sometimes using the opposite hand can be helpful to avoid your knee coming away from the other one. Alternatively, you may be lying on your side. Bring your heel to your bottom, hold the foot, keeping the knee down, and then stretching the knee back behind, feeling some stretch on the top part of the muscle as well as lower down. Again, lying on your tummy, you can bring your heel towards your bottom, again using a strap or a towel. In this position, make sure the front of your hip stays flat on the floor. The muscle on the front of the thigh, as well as the quadriceps, but higher up on the front of the hip, is particularly important to stretch. This is because we spend a lot of time in sitting, and so therefore they can become very tight. Several ways of doing this. One of them is in sitting, side onto the chair, and bring one leg back behind you, trying to creep your toe back as far as you can, feeling a stretch on the front of the hip. Your back against the chair is what keeps you supported and stops you going forwards. Another way of doing it on a chair is to stand beside the chair, placing one knee on the chair. This is the leg that we're going to stretch. The other leg then steps through, going past. Make sure you keep your hips square on, tuck your tummy in so you don't overly arch your back, and just move your hips forwards a little bit, bending this knee, and you feel the stretch on the front of that hip. If you're comfortable kneeling, you can do this stretch in a lunge position. Make sure your foot is well forwards so that as you come forwards, your knee stays above your ankle. We're then feeling the stretch in the front of the hip over here. Keep your body tall, don't overarch your back, and feeling the stretch in the front of the hip. And relax. Another important muscles to stretch is the piriformis and other deep rotators of the hip. These are situated in the buttock area. Often, pain in the side of the hip and down the leg, particularly sleeping on that side at night, is a symptom of tightness of these muscles. One way is to bring the leg up and rest it on your other leg, and then bringing that leg towards your chest, and you can get a stretch in the buttock area. Alternatively, leaving that leg still and holding the knee and the foot, you can bring the shin towards your opposite shoulder. This enables you to add more or less stretch on the knee or the foot so that you can feel the stretch in the most important position for you. Alternatively, in sitting, you can also bend the knee, support the knee and the foot, and bringing it up and across towards your shoulder. And relax. The hips often become stiff with AS, and it is important to stretch the inside of the thigh. Placing one leg on a chair, or if you need something lower, start with a stool. In this position, you can bend your standing leg and get some stretch on the inside of the thigh. Alternatively, standing up and leaning to this side, bringing the other arm over the top, can also give some stretch to that area. Another position, sitting on the floor, is to put the soles of your feet together and allow your knees to drop out to the side. Keep tall in your body as you do this. Another important muscle to stretch is the calf muscle. Keep your foot in a straight line, the heel down, and gently move the hips forwards. Make sure the heel stays on the floor and the knee stays straight, feeling the stretch through the muscle area. Avoid bending your trunk too far forwards. Keep nice and straight. Alternatively, on a step, you can simply drop your heels over the edge and hang and feel a good stretch. Regular, moderate exercise of at least 30 minutes per day is needed. As well as this, it is important to exercise the whole body. A fitness program, sport and recreational activities are also important, in addition to your specific program. It is beneficial to do some activity to get you out of breath on a regular basis. This helps your fitness, but also helps to move all joints in the rib cage. Using existing community facilities is useful as part of your exercise routine. This may be individual or group. Going to the gym, doing Pilates, yoga or Tai Chi, or aqua fitness are all beneficial.